Welcome doctors to part 2 of my lecture. We were studying general anatomy. Today, we will discuss an important topic related to phonation, which is the physiology of larynx. It is a very important conceptual topic and examiner's most favorite. Don't forget to subscribe my channel. This is the general anatomy of larynx. Please have a quick look at the most important muscles and cartilage. Further, we will discuss every single one in detail. Remember, it is a very confusing topic, so having a good concept is very important for solving tricky MCQs. Stay focused. Vocal ligaments, also called vocal folds, shown in green color, are fibrous bands located in the larynx that vibrate when air passes through them, producing sound waves and allowing for speech and singing. The thyroarytenoid muscle shown in the green color in this picture is located in the larynx and consists of two parts, the thyrovocalis and the thyromuscularis. It plays a crucial role in phonation by controlling the tension and length of the vocal cords, allowing for changes in pitch and volume of voice. The vocalis muscle, also known as the thyrovocalis muscle, shown in the green color in this picture, is a part of the thyroarytenoid muscle located in the larynx. It is responsible for controlling the tension of the vocal cords, which allows for the production of sound during speech and singing. The thyroarytenoid and vocalis muscles control the tension and thickness of the vocal cords, affecting pitch and volume during phonation. When contracted, they shorten and thicken the cords, resulting in lower pitch and increased volume. When relaxed, they lengthen the cords, leading to higher pitch and decreased volume. Injury to the recurrent laryngeal nerve can cause paralysis of these muscles, leading to voice changes such as hoarseness or weakness. The posterior cricoarytenoid muscle shown in green color is a small triangular muscle located in the posterior back portion of the larynx. It originates from the posterior surface of the cricoid cartilage and inserts into the muscular process of the arytenoid cartilage. The muscle is innervated by the recurrent laryngeal nerve, a branch of the vagus nerve. The primary function of the posterior cricoarytenoid muscle is to abduct, open, the vocal folds during inspiration, allowing air to flow into the lungs. It is the only muscle of the larynx that has this function and is therefore critical for normal breathing. Dysfunction or damage to the muscle can result in difficulty breathing and may require medical intervention. The primary function of the posterior cricoarytenoid muscle is to abduct, that is, open the vocal folds during inspiration, allowing air to flow into the lungs. It also plays a secondary role in voice production. When the muscle contracts, it pulls the arytenoid cartilages, which in turn stretch and tense the vocal folds, contributing to the production of higher-pitched sounds. Overall, while the posterior cricoarytenoid muscle does contribute to voice production to some extent, its primary function is related to breathing rather than phonation. The lateral cricoarytenoid muscle shown in green color in this picture is a small, paired muscle located in the larynx that adducts, that discloses the vocal folds, enabling phonation and playing a key role in voice production. When the lateral cricoarytenoid muscle contracts, it adducts, that discloses the vocal folds, allowing phonation by creating resistance to airflow. When it is relaxed, the folds separate, decreasing resistance and producing a breathy voice. Hence, contraction of the lateral cricoarytenoid muscle increases tension on the vocal folds, leading to a high pitch of voice. Relaxation of the muscle reduces tension, resulting in a low pitch. However, pitch modulation typically involves the coordination of multiple muscles in the larynx and respiratory system. The transverse arytenoid muscle shown in green color is located in the larynx that runs horizontally between the arytenoid cartilages. It plays a key role in adducting the vocal folds during phonation. The oblique arytenoid muscle is a small, paired muscle located in the larynx that runs diagonally between the arytenoid cartilages. It contributes to adduction of the vocal folds during phonation. So we can conclude from previous discussion that the oblique and transverse arytenoid muscles work together to adduct, that is, close the vocal folds, allowing phonation. Contraction of these muscles increases vocal fold tension, resulting in high pitch, while relaxation decreases tension and lowers the pitch. The cricothyroid muscle, shown in green color, stretches the vocal folds by tilting the thyroid cartilage forward and down, thus increasing their length. This results in a high-pitched voice. Relaxation of the cricothyroid muscle allows the vocal folds to shorten and thicken, resulting in a lower pitch. This is the summary of the lecture. The adductors of vocal cords tenses cords and causes high pitch of voice. These are the adductors: lateral cricoarytenoid, oblique arytenoid and transverse arytenoid. On the other hand, the abductors relaxes the vocal cords and lowers the pitch. The adductor is posterior cricoarytenoid.